Okay. Again, thank you all for hopping on this afternoon. Commissioner Lambrou and I are joining you today to discuss Governor Mills's announcement earlier that accelerates vaccination eligibility across the state of Maine. Starting this upcoming Tuesday, March 23rd, Maine residents 50 and over will be eligible to receive COVID-19 vaccine. And on Monday, April 19th, Mainers 16 and over will be eligible for COVID-19 vaccine. To put that differently, in about 1 month from now, everyone 16 and over in Maine will be eligible to receive COVID-19 vaccine. There are two reasons why we are making the change today. The first has to do with the progress to date that we've made. A few numbers here to set the table. As of this morning, we have administered as a state 562,483 shots of COVID-19 vaccine. To put that in perspective, over 1 in every 4 Mainers has received at least 1 dose of vaccine, and over 15% of people in Maine have completed their vaccine series. Progress is being made. And as of this morning, more than 100,000 people in their 60s alone and another 100,000 people in their 70s have received at least their first dose of COVID-19 vaccine. Again, in percentage terms, that means that about 50% of Mainers in their 60s have received at least a single dose, and about 80% of people in their 70s has received at least a single dose. If you combine all people in Maine, 60s, 70s, 80s, and older, about 2/3 have gotten their first shot, and more than 1/3 have completed their vaccination series. So we are making steady and sustained progress. But there's another element that prompted the change today. Last weekend, Commissioner Lambrou and I separately had the opportunity to visit vaccination sites across the state. And we asked them not just how things were going, but also to let us know how quickly and completely their spots for vaccinations were being filled up. And throughout the course of this week, we began hearing that slots were not going as quickly as they had been a couple of weeks ago when we moved into the 60 plus category. And in some parts of the state, we started hearing in the last day or so that a few slots were starting to go unfilled. That doesn't work for us. That's why, in concert with the progress that we've made in our 60 plus and 70 plus tiers, that's why we advised the governor and why Governor Mills made today's announcement about accelerations in those eligibility categories. This announcement continues our forward momentum. We don't want to slow down the line one bit. And today's acceleration announcement allows us to keep making steady, sustained progress to vaccinate the state. We've notified health systems, pharmacies, and vaccination sites across the state to begin updating their registration systems to reflect this change for those 50 and over. That may take a bit of time. And that means that even though you may become eligible on Tuesday, if you're a Mainer 50 and over, it may still take a little bit of time in some places to secure an appointment. So with that, Commissioner Lambrou, anything on your end?
I would just note that we, in addition to the March 23rd start date for the 50 to 59-year-olds, we also chose April 19th for people ages 16 and over, because what we do know is there are about as many people in their 50s as there are in their 60s. And even with the relatively limited supply we've had in the past 3 weeks, we were able to vaccinate close to 2/3 of 60-year-olds. So we do expect that without a significant new increase, we can get through 2/3, which is our target of the 50-year-olds, which allows us to move on with the promised increase of supply from the Biden administration to all people ages 16 and over. I would note, though, as we move into that broad eligibility group, we will continue to do what we did from the outset, which is allow there to be within eligibility group prioritization to make sure that those people who are at higher risk, be it because of a medical condition, a disability, or because they have barriers to getting a vaccine, they're homebound, they somehow otherwise struggle to get access to our healthcare system, We will continue those strategies as we move through these eligibility groups and intensify them as we move to that final eligibility group, which is all residents who are eligible for the vaccines that are authorized.
Great. Thank you, Commissioner Lambrou. One final note on some numbers around a little bit more data around this. The category of those aged 50 to 59 in Maine includes 197,000 people. 32,000 or so have already received at least a first dose. So overall, this means that approximately 165,000 people will be newly eligible to receive COVID-19 vaccine starting on Tuesday, the 23rd. So with that, we'll turn it over to our colleagues in the media. The first question goes to Lauren Healy from WGME.
Hi, Dr. Shaw. I'm wondering with this announcement, how clinics will be able to keep up with the demand of people calling. Will there be more people hired to be on the phones with scheduling, and how exactly will that work?
Sure. We've heard different things from different clinics. On the scheduling side, we've heard that certain clinics will be increasing or beefing up their availability of folks to help get folks scheduled. Other clinics are trying to increase their overall throughput by hiring more vaccinators or having longer hours, or in some cases, maybe even adding more clinics per week. So I think it will be a mixture of different factors. With 135,000 people being eligible at once on Tuesday, it's going to take time. Again, we don't want to slow down the line. That's why we're making this change to continue that strong forward momentum. But we also recognize that making 135,000 people eligible may take a little bit of time. Folks may have a little bit of a challenge finding an appointment slot, but those slots will become eligible. I'll also note that, as the commissioner noted, a lot of this is based on the increased availability of vaccines that our federal partners have indicated is coming later this month and into April.
We too also expect to be able to activate more of our Maine response volunteers as we go into this new phase. Our EMS partners have been great at pitching in when there's a need. We may need that on a more ongoing basis. And we're hoping with more supply, we can reach out to, for example, independent primary care practices as new access points. So in addition to expanding the hours of current sites, we also will be looking to add new access points as we go through these new ways of increased vaccine doses.
Let me go to Phil at WMTW next. Phil? All right, we'll come back to Phil while we go to Dustin at New England Cable News.
Hi, Dr. Shaw. The first thing I want to ask is, thinking about where we were a year ago and making this announcement, how do you feel right now?
I mean, it's here we are 53 weeks to the day after our first case in Maine. And what we're talking about is accelerating our vaccination rollout. I think, I was thinking about this morning, Dustin, like, was there anybody out there who thought 53 weeks ago that this is where they would be? And if they did think that, then boy, hats off to them. I mean, this is welcome news for those of us who have been working on it, for so many Mainers who have been waiting for their shot. This is positive, and I know that I think I speak for the commissioner. We're encouraged by this. I think it brings a smile to both of our faces to be able to accelerate in this fashion. We're hoping to be able to keep that steady and sustained progress up. This is about getting as many shots into arms as quickly as possible so we can stay on that return to normalcy.
Is there anything significant that comes to mind logistically that needs to be done to get to that 16 and older age group? I mean, we think about the scale of the clinics that we have right now, the scaling up they're able to do, but this is a huge amount of people.
It's a lot of folks, no doubt about it. I think there are some other things that we're working on. I'll just pick up on one note that the commissioner mentioned. Some of the strategy is expanding the capacity at existing sites. Can the large scale and medium scale sites that we have already, can they add more people per hour to vaccinate, more hours per day and more days per week? That's one strategy. But we've said all along that those sites are not for everybody. So we're looking to activate additional ways for folks to get vaccinated, new pharmacy options, new vaccination options, perhaps even at your doctor's office. So that logistically expands the purview, the ambit of where vaccines are available. For us, that's going to be the key. We've seen that certain parts of the state, like Somerset, Oxford counties, to name just two, are not where other parts of the state are. So we want to really focus in on those parts of the state and make access as easy as possible. Commissioner?
I
We've
would
seen,
just add,
oh, sorry.
good. I think that's fine. Thank you.
Okay.
We've seen a couple drive-through experiments across the state. Is that something that you might think is going to get rolled out in a larger capacity?
100%. We have been working with EMS clinicians as well as different types. Sorry, Dustin. Yeah, we've been working with EMS clinicians as well as other groups that have been working on drive-through type applications. We see those as a larger component, particularly for the use of the J&J vaccine. It doesn't have the same storage requirements as we've discussed, and so the drive-through events that have happened in the state, there have been now 2 in Buxton. There was one on Wednesday. There was one last Friday. At least one in Old Orchard Beach. They've been successful. The chiefs who have organized those events, I've had the chance to speak personally with Chief Schools from Buxton to download with him what he learned and how they're working to do that more quickly. I think that's going to be an increasing component of our vaccination landscape, Dustin.
One last clarification. Is it 135,000 people that are becoming eligible or 165,000 people becoming eligible?
Sure. Let me, I think I misspoke. So I'm glad you raised that. I'm looking at my notes now. Let me just run through the numbers top to bottom. The size of the population in Maine people who are 50 to 59 is 197,000 people. But about 32,000 of those folks have already received a first shot. Maybe they are healthcare providers or otherwise eligible in 1A. So that means that overall, 165,000 people will become newly eligible to receive a COVID vaccine starting on Tuesday, the 23rd.
Thanks.
Yep. Over to Caitlin Andrews at the BDN.
Good afternoon, Dr. Shaw, Commissioner Lambrew. Nice to speak to you unexpectedly this Friday afternoon. My first question is, do we know how many people in the state are under the age of 50?
Under the age of 50. Hold on. We can get that for you in just a second. If I'm trying to do the math in my head, but yeah,
I'll calculate while you answer the next question.
Okay, next question, Caitlin.
Okay, so it seems like a big reason for the shift is that we're not seeing shots going out as quickly as expected. Does the state have a sense of whether are vaccines like not reaching people who might be currently eligible, who might be harder to miss, or do we think this is more about an unanticipated slowdown in demand? What are your thoughts about why that might be?
I don't want to speculate too much. We haven't done surveys or anything like that, Caitlin. So here's what I can say. The experience that we are having in Maine right now has been mirrored in a number of states across the country, from Alaska to Mississippi and points in between. In conversations with my colleagues in a number of those states, Alaska, Mississippi, Kentucky, to Michigan, to name a few. There's a couple of things that are happening, I think. One is that there may be, a lot of folks in those age categories are also simultaneously working and things like that. And so they may not be there on day one of eligibility to get vaccinated. They may have to balance work schedules, things like that. There's also concerns out there that there may be a little bit more hesitancy in these groups. That's a concern. It's a hypothesis. I don't have any data to back that up, though, but it is something that has been on a lot of folks' minds.
Sure.
Okay.
Back to the other question. I think the question was, how many Maine residents are under the age of 50? Remember, we're talking about primarily people 16 to 49 because there is not yet a vaccine that's authorized for people under the age of 16. So in total, there's 554,000 people in Maine who are between 16 and 49 years old. Of them, 71,000 have been vaccinated already. So that leaves 483,000 roughly.
Okay. And I guess my last question would be around what time, you mentioned, that you had been visiting some clinics last week. Was there a time before that where you were kind of looking at the numbers and looking at vaccines going out, being geez, we may need to start opening this up broader or speeding up our timeline?
I'll speak for myself. Not concretely, Caitlin. I mean, Commissioner Lambrew and I we talk about this multiple times per week, per day. We're always looking at the numbers, she and I independently, and then comparing our analyses and our notes of what we're both seeing in the data. So this is part of an ongoing process that I'm confident in saying that Commissioner Lambrew and I have been undertaking since December 14th of last year, pretty much every day, looking at the numbers. What are they telling us? And whether there are changes to be made. And really in the last 36 hours or so, 24 hours even, we started to see some signs, and we don't want the line to slow down one bit. But there wasn't a discrete event that said we need to make a change.
Okay, thank you.
And Caitlin, if I could just amplify one other thing, I don't think I was as artful as I should have been. The fact that there are some slots that are going unfilled, or that they weren't being snapped up in 30 minutes as they were maybe a month ago or 3 weeks ago, I don't want to immediately conclude that that is a sign of hesitancy. It might be. It may be the earliest glimmers of hesitancy or the earliest signs, but it may just reflect the fact that the categories that we're moving into, those in their in their 60s and then on the 50s, 40s, they may have other obligations in their lives that mean that they're not snapping up spots immediately. So I don't want to just automatically equate that to hesitancy. Could be, but not necessarily so.
Okay, I guess that then kind of makes me wonder, are you concerned that these people then may later try to sign up for vaccine, but find that other people have already kind of jumped in there? Do we think that supply is going to be sufficient to carry these people forward? I guess, like, how are we thinking about that?
We think about it on two axes, supply and capacity. It's not just the supply of vaccine, but it's our ability to turn vaccines into vaccinations. And on that front, we're encouraged both by the supply that we understand is coming, as well as the efforts that providers in Maine have made to scale up their efforts, as I talked about a moment ago, and as we did with Dustin's question. So even if those individuals later say, hey, you know what, I've got time this week, I want to get a shot, great. They are welcome to do so.
And I will just add one big thank you to people in Maine. In our visits to these vaccine clinics, we find that many of them are staffed by volunteers, community members who want to help out. Many of them have people who are observing people after they've gotten their shots, who are physicians or surgeons, because those healthcare personnel want to be part of this one-time unique effort to try to get our residents back on a path to normalcy. So that gives me confidence that our partners in the healthcare sector, in our communities, in our emergency medical system, our volunteers will be there when that big, bolus of vaccines that President Biden has promised will come. We're very encouraged by that because that's always been a concern. If the supply comes, will we be ready? But at least through all of our work, through all of our interactions, we feel like the Maine population stands ready to catch that vaccine when it comes and put it straight into people's arms.
Thank you to both of you.
Yep. Thanks, Caitlin. Phil, let me turn back to you.
Hello, Dr. Shaw, Commissioner Lambrew. Thanks. Hope you can hear me okay. Here's my two-part question. Two questions. First is, I couldn't help noticing the coincidence between this accelerated schedule starting Tuesday and the governor's reopening schedule that starts Wednesday, allowing indoor venues at 50% capacity and outdoor venues at 75%. Here's the question. Right now, we're only at 26% vaccinated as a state. What do you feel is a safe percentage for us to really be reopening in the way that we plan to do so? I mean, after all, Dr. Anthony Fauci has said 70% is really the immune point that we want to be at, herd immunity, before it's really safe to get back to normal. So what percent do you think we're going to be at next week? And part two, I was certainly surprised to see that we're lowering the age down to 16. That's somewhat incredible. Are other states, any other states, going so low age-wise so fast in April? And are there any special concerns given that vaccines for minors and children, I thought, were still being tested? Thank you very much.
I'll start with the latter question, Phil. It's an important one, and then I'll turn it over to the commissioner on the former. Phil, as to the latter, I just want to be very clear. The vaccines are authorized. One of the vaccines is authorized for individuals 16 and over, that by Pfizer, and then the Moderna vaccine is authorized for individuals 18 and over. So we are not going outside of the boundaries of for what the vaccines are authorized for. We are sticking very closely. We are sticking entirely, in fact, with what the U.S. FDA and the U.S. CDC's advisory committee have recommended for the vaccines. The other part of that piece of the question, other states have also moved in this direction recently. Alaska, then shortly followed by Mississippi, and just today, I think a number of other states have, I think, seeing the same trends, moved in this direction. So Maine is not unique in that regard. Not all states have done so, but we are not alone, though.
And in fact, I do think that right now, most New England states have done so on a very similar schedule. I know, for example, that New Hampshire is going to people age 50 on Thursday rather than Tuesday. They're going to all people, adults in the middle of April. Vermont made a similar announcement. Connecticut has already made that announcement. I think Rhode Island has as well. So we are not alone because we're all doing the same thing, which is when we're getting the vaccine and moving it through, we're getting a prorated amount of supply. So we all are roughly moving through these same groups in a similar pace. But going to your first question about the policies that the governor announced about gathering limits, those were developed partly with vaccination in mind, but mostly with our checklist in mind, what we've learned about safe protocols, about how you can layer mitigation to keep people safe and to increase economic activity. Our case rates, while still higher than we'd like them to be, are still a lot lower than they were in November, December, and early January, which means that we can, with protocols, begin to increase our engagement, increase our economic activity, begin that moving forward process. The governor announced it in 2 stages to make sure that we are both keeping on top of the growth of cases as well as keeping pace on vaccination. So another major change will come at the end of May, beginning of May and the end of May, depending on, again, how we're doing. We'll always have the option to dial things back should we see, for example, variants of concern become prevalent or other outbreaks that cause us concern about our hospital capacity or other elements of our economy. But we did make that announcement hoping that we would be on pace with vaccination. We're ahead of schedule, but it is partly related to vaccination, mostly related to the protocols that we continue to refine and update. Just today, for example, the Department of Economic and Community Development released an updated lodging checklist. They released a few last week as well, a general one. So we continue to update our guidance in line with what we've learned about safe mitigation. But as a reminder, we're going to be keeping up these mitigation protocols all the way through the summer, even after everybody's eligible, because wearing a mask, keeping physical distancing, appropriate hand washing will become important until we get all people, including children, vaccinated.
Let me turn it over to Robbie Feinberg next.
Thanks, Dr. Shah. My only question is, when we talk about the anticipated increase that we hear about a vaccine from the federal government, have they given any indications of just how much that increase might be? What have they told you all?
Nothing concrete, Robbie, and it does vary by vaccine. So we believe that the most significant increases in volume will be for the Johnson & Johnson vaccine. That's helpful for us because, as we mentioned a moment ago, drive-through type applications are hoping to be something we can roll out and expand. But we don't have specific concrete estimates for Maine as to what that will look like, other than having a sense that they are going to be significant. And we've been told to start planning for that increase, which we've been doing for weeks now. So that's sort of where we are with respect to what we think is coming, starting perhaps the week of March 29th, but just as plausibly the week of April 5th.
Great, thank you.
Over to Kelly Bouchard at the Press Herald.
Hi, Dr. Shah and Commissioner Lambrou. Thanks for taking my question. I just wanted to be a little more focused on the idea of whether or not there is some reluctance that might be cropping up as we open up. And the reason I ask this is because it's not just necessarily a matter of appointments not being snapped up. Some are going unfilled, right? And I would, I also, we have a number of I hear from folks regularly who are still having trouble getting appointments. So is there some sort of unevenness that you're trying to address, where if it's just open broadly, that people will get where they can get? I'm just, there seems to be an urgency to this end of the week announcement that I'm wondering if you can speak a little more specifically to any concerns you might have about reluctance and availability. Thank you.
Sure, Kelly, I'll start. The urgency, such as it is we don't want the line to slow down one bit. Again, earlier in the week, we started hearing from providers saying, okay, we're analyzing when we might be able to open up to those 50 and over. And then just in the last day or so, maybe not even that, providers saying, yeah, the velocity with which appointments are being opened up and then snapped up is not what it was a couple of weeks ago. And then even in a few instances, perhaps even outliers, there were instances of appointments not being filled entirely at the time they came up. So we wanted to, that doesn't work for us. There are folks who want to be vaccinated in that next age tier. And if there are hints that the line is slowing down in some parts of the state, we want to take every step we can as expeditiously as we can without missing a beat to open up more eligibility. I don't know. There will be time to analyze whether it's a function of folks are being busy, folks are hesitant. We're trying to get a better handle on that. But right now, if we see that the line is even potentially starting to slow down, we want to add more folks to it so it doesn't do that.
Okay, thank you.
And our approach all along has been to be driven by this evidence. So, we apologize this is happening on a Friday and not on our usual Tuesday and Thursday press conferences, but we're going to make changes when we think it's timely and appropriate to do it. We are giving some days before we're doing it. This is Tuesday. Some clinics will be ready, some clinics won't be. We appreciate that. But our approach throughout this whole pandemic has been to be flexible as well as equitable, focusing on efficiency as well as speed. We continue to be in a race against these variants.
Mm-hmm.
We continue to make sure that we are doing everything possible to get as many people possible vaccinated as possible, because we're not out of the woods yet. And so that is the approach that the state of Maine has taken under Governor Mills' leadership, and we'll continue to do that.
Well, thank you very much, and I'm glad to be in the running now.
I think that's a lot of folks. Well, 160,000 to be specific, and we're hoping that they will be able to get a shot as quickly as possible. The last question for the afternoon goes to Zach Blanchard.
Thank you, Dr. Shaw. Thank you, Commissioner Lambrou. Some exciting news here for sure. You mentioned this idea that it's going to take some time for the healthcare organizations to get scheduling online, that sort of thing, just to get those systems updated. Any update on a statewide pre-registration? Has that been kind of amped up a little bit given this, as other states in New England have this in place?
Oh yes, it most definitely has. So we are getting closer and closer. I anticipate that something we'll be discussing more next week. But we are getting closer, and we certainly recognize that as we are making more folks eligible, as well as trying to bring on more sites for vaccination, having a better way to schedule folks will be an essential component of that. My usual reminder and note that some of the larger scale sites already have great success with their existing scheduling platforms. We're not looking to displace that. What we're looking to do is provide a solution for sites that are not satisfied with their existing platform, or for groups of providers who have said, hey, we're willing to come together for the next 4 Saturdays and provide vaccine for folks in a drive-through or at a gym somewhere, at a school gym or an open location. But scheduling is really hard to do. Can you help us with that? Our solution is to help the groups that are not thrilled with their existing platform, or to be a solution for those groups for whom having that availability speeds up their ability to come online.
And last question real quick for you. What is your just final message? You kind of touched on this again, that it's going to take some time. Just because we're opening the doors doesn't mean you're going to be able to get an appointment right away. So what is your message to folks in regards to patience here?
Well, that is part of it. And I'll offer mine and then again turn it over to the commissioner. But I think my message is twofold. The first is that this is another step in the right direction. We are continuing with our steady and sustained progress and keeping our momentum going. We don't want to slow down one bit. It's that drive that has kept Maine where we are with respect to all things COVID, whether it's low case rates, whether it's high testing, and now a robust vaccination coverage. We don't want to slow down the line one bit. But any kind of change takes time, especially a change that affects over 130,000 people. It's going to take a little bit of time. Eligibility is the first step. The next step is getting scheduled, and then the third step is getting your shot. We urge everyone to do so, recognizing that it might take a little bit of time to have all of that happen.
And we are thrilled to be able to be here today talking about Governor Mills' acceleration of our schedule, but that is counterbalanced with, again, it will take work, it will take time, it will take some patience. Again, we're moving from, groups of people that are about 200,000 minus those who might have already gotten vaccinated to a number that's more than twice as much that. But we have heard, and we're doing this because we have heard that the 100 million extra doses of Johnson & Johnson vaccine that President Biden procured are coming. We have heard that by May 1, there should be enough doses for all adults in the nation, which should enable us to begin that hard work to broaden out our sites, to extend our hours. We'll go into nights and weekends if we need to. If that's what we need to do to administer these doses, we will do it. So we are absolutely excited that we are getting to the point where we can say to every person in Maine who's eligible that they can get a vaccine, but then it's on us, on our providers, on our volunteers to make good on that along with the supply chain. So we are excited, but we are going to also have to be patient to recognize that there's going to be bumps in the road and that we will all continue to need to do what we've been doing, wearing the face coverings, keeping that distance, minimizing those large gatherings until we are truly to a place where all Maine residents have been vaccinated to the extent that we need.
Great. Well, on that note, thank you all for your time this afternoon. Commissioner Lambrou, as always, thank you for joining me. And we hope everyone has a good weekend. We look forward to chatting again on Tuesday. Thanks, everyone.